Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hi, everyone. This is Nurse Paula. Thanks again for joining me this week on It's a Young Thing. And you know, one of the biggest topics that we do discuss is bulges of fat and diet and exercise resistant fat that just doesn't go away. And we do talk about some non-invasive procedures, but today we're going to talk about the most popular minimally invasive procedure called SmartLipo. You know, people want results and they want it fast. They want it instantaneously, and they don't want to wait for a minimally invasive procedure to reduce these bulges of fat over the next couple of months as your body gets rid of the byproduct. So a lot of people are turning to SmartLipo. And with me today, I thought I'd bring in the expert that I know of SmartLipo, and that would be my husband, Dr. Thomas Young. And, you know, Dr. Young has had over a decade of experience performing laser body sculpting procedures. He's done thousands of procedures. He's trained side by side by some of the best doctors in the country. And now he trains other physicians in the art of body shaping and body sculpting. So, Dr. Young, welcome to It's a Young Thing.
Well, thank you for having me.
You're welcome. So, you know what? Today I wanted to talk to our listeners about SmartLipo. We already talked about cool sculpting in a previous podcast, a little bit about VeloShape as well, how they can reduce pockets of fat. So can you tell our listeners why SmartLipo is so different from a non-invasive fat reduction system?
So the first thing we want to do is probably define SmartLipo. So SmartLipo really is just a laser. And really the procedure they're getting is awake, tumescent laser liposuction.
Well, a lot of people don't know what tumescent means. So for our listeners, what tumescent is, it's a fluid that we use to kind of numb up the area that's, you know, underneath the skin where we're going to do the procedure, where SmartLipo is going to be performed. And tumescent anesthesia is comprised of like a normal saline solution with a little bit of epinephrine in it to kind of constrict the blood vessels to reduce bleeding and bruising. And also it has some lidocaine in it, and that's the number one ingredient that's in tumescent fluid. Lidocaine is what's going to numb the area. So this tumescent fluid is put under your skin through a tiny puncture hole, and it's kind of lets it, you know, Dr. Young lets it sit there for a while, so it kind of numbs everything up so you really don't feel the procedure that's going on. So can you tell us a little bit how the procedure is performed?
Well, as you were mentioning, all the work's done through little holes. Step one is to put in the tumescent fluid, which is really the key to the procedure. You're awake during the procedure. We do give you a couple of relaxing pills to help with the procedure. After you're all numbed up with the tumescent solution, the next step is the laser. The laser's passed through the little hole under the skin into the fat, and that helps to melt the fat and tighten the skin. And that's what makes the procedure a better form of liposuction.
Oh, that's great. So you're getting fat reduction, but you're also causing skin tightening. And how long does it take for that skin tightening to kind of be apparent to the patient?
Some of it is immediate because it's in different steps, and some of it is over 2 or 3 months.
And so what type of body areas can somebody get SmartLipo done in?
Well, I'll tell you the common areas, and I'll tell you the less well-known areas.
All right, go for it.
So the common areas are the abdomen and waist, inner and outer thighs, arms, male chest, and your chin.
That's a lot of areas.
Those are the common areas that we will do. Lesser known areas are female breasts.
For breast reduction?
For breast reduction.
That's fabulous.
It's a great alternative to the traditional surgery with scars and downtime and a big change.
Oh, that's great. So tell me, what are some of the risks that can be associated with a SmartLipo or any kind of laser liposuction procedure?
So the risks are very uncommon, but they do exist. And those we would cover more during a consultation, but there's no common bad complications that I would warn people about.
Now, SmartLipo, I mean, everybody calls SmartLipo, I mean, it's kind of like a household name, isn't it? I mean, there are some people that are doing laser lipolysis with other devices on the market, but they're still calling it SmartLipo.
Correct. And that's why we were differentiating that the SmartLipo really is one type of laser, and the procedure is really just the awake procedure.
The wake procedure. So other things that you might hear it called if you're researching this on the web is like laser lipolysis. And we already broke down that word before. Lipolysis, you know what that means. It breaks down fat. But SmartLipo really was first to market with this fat melting device that goes underneath the skin. So they pretty much branded the market. So everybody, says, no, I'm not going in for laser lipolysis. They'll say, oh, I'm going to, research SmartLipo because now it's a household name. So tell me, Dr. Young, what are some of the expectations that a patient could, have with SmartLipo?
So depending on the body part and the person's unique composition, are we taking a little bit out of an outer thigh? And in that case, my expectation would be to make it look very natural. If someone's had some children and they have some loose skin, a little bit may remain. So we expectations are all unique. Everything should look natural. Everything should be reduced nicely. One of the things as we talk about laser lipolysis,
right, is
to warn people about the external devices where they're using the same word to capitalize on that.
Oh,
such as the strawberry laser and the Zerona. And the other ones where they're trying to use the same name of laser lipolysis from the outside. And those devices tend to be minimally effective.
Because it's non-invasive procedure. I got it. Okay, great. So who is a candidate for SmartLipo?
So when people ask me that question, I say most people that have problem areas are candidates. The people that may not be, they might have a significant medical condition, a bleeding problem or a significant heart problem, because these are done awake, usually in a doctor's office, even though patients are monitored. If someone's too large, but then that's all relative depending on what body part we're doing.
So how much fat can you take out of a patient in a typical procedure? Like somebody's really coming in with a big abdomen and waist, fat up on their flanks, and they really want to get that whole area reduced. How much fat can be reduced from a patient or taken out of a patient during one procedure?
The limits of the procedure tend to be the amount of numbing solution we can use. If I think that the area is too much for people, then we just break it up into different parts.
Oh, simply because of the lidocaine. Yeah, that's true. I didn't think about that because of the lidocaine toxicity. You can only have so much of that in your body. So the cool thing about laser lipolysis, everybody, is that, Dr. Young can do, and any other doctor that's really experienced and skilled at this, can do either fat reduction, like body shaping, or even body sculpting. I mean, there's some people that can come in with maybe no notch underneath their butt, and they wanted to get that nice shaped formed butt. You can actually sculpt with the SmartLipo device. Is that correct?
Yes. Sometimes we're sculpting the buttocks. Sometimes we're sculpting the ab muscles a little bit, bringing back definition in the arms. Those are common areas. That's
great. I really thank you for being my guest today and for joining us and talking about SmartLipo and laser lipolysis. And, I want you all to listen to this out here. There's like any cosmetic procedure, you really should evaluate your physician by 3 criteria. Number 1 is, how are they trained? And number 2 is, how long have they been doing this? When do they do it? I mean, get those numbers. How many procedures have they done? How long, how many years have they been doing this? And the number 3 thing is, what's their reputation? And, you can look at online reviews. They're not always real. They're skewed. And sometimes you have more people that are dissatisfied that write reviews half the time than you do people that are happy. So you really got to take online reviews with a grain of salt, kind of like average the numbers in as you're reading them. But also talk to your family and friends who are pleased with the results and find out where they went. So these are 3 things that we at Young Medical Spa, we really recommend that you think about when you're looking for an aesthetic provider. So that's all I have for you this week on SmartLipo and laser lipolysis. Thank you again, Dr. Young, for joining us, and make sure you subscribe to our podcast. It's on our website at youngmedicalspa.com, also iTunes and SoundCloud, and make sure you share with your friends. I'm sure you know somebody out there who's fighting the bulge and really would like to know a little bit more about SmartLipo SmartLipo. Thank you so much, and we'll talk to you next week.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes, so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. Steve Mittinen, socialmedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.